While the debate over Neuralink continues, the company has already achieved impressive success with its first two human trials. The implantation of a chip in the third patient will soon begin, with Elon confirming that a total of 10 implants are planned for this year. The third patient is set to receive telepathy through the newly improved chip technology, with the procedure expected to take place next month if everything stays on schedule. While Neuralink's telepathy product is primarily designed for motor function restoration and control, it's the Neuralink Blindsight that really captures our attention. This type of chip has the potential to change the world and transform the future for numerous patients. Today's episode will provide the latest updates on human trials and explore how Neuralink is working to restore vision. Welcome to Tesla Car World. 1. Neuralink Human Trials Update. Before briefly discussing the plans Neuralink will undertake with the third patient, we want to give you an overview on the first two patients, in case you missed any of those details. Your first patient, Nolan Arbaugh, was the pioneer of the company's human trials after getting FDA approval. Nolan Arbaugh, 29, lost his ability to move at the age of 22 due to a sudden diving accident in an artificial lake during a summer camp in Pennsylvania. Although initially people thought his injury was due to jumping from a height, the reality is that he had run into the lake with friends and felt something hit him. After waking up face down in the water and realizing he couldn't move, Arbaugh became a quadriplegic. We feel like the accident was a nightmare because it all happened so quickly. Fortunately, he retained cognitive function and was able to perform many tasks primarily using a mouth stick, a specialized assistive device for quadriplegics. After many years of treatment, he applied to participate in the Neuralink trial as soon as the company announced they were seeking their first patient. Nolan received the first-gen Neuralink chip in January of this year. Shortly after the implantation, Nolan showed excellent recovery results and was able to control the mouse on a screen only by thinking. He even played chess and posted on X with the help of Neuralink, as announced by Elon on X. However, trouble struck just a few weeks after Nolan got the chip. His chip malfunctioned as nearly 85% of the threads on it retracted from the brain tissue, leaving only 15% operational or actually working. This caused Nolan to be terrified and even brought him to tears when he stopped getting signals from his brain. The malfunction hindered the data transfer speed, accuracy, and sensitivity of the chip, and he feared losing the benefits the device had previously given him. However, the Neuralink team quickly addressed the issue by modifying the recording algorithms of the implant. The initial cause of the problem was identified as an air pocket at the front of the head during surgery. The chief surgeon believed that this hair pocket might have moved to the top of the skull, pushing the brain away from the implant and causing some of the sensor threads to retract. Another reason was that the implantation technique still had shortcomings, which led to tension on the threads. However, until now, the chip in Nolan's brain has returned to normal and is functioning quite well, providing him with many incredible abilities, which we call superpowers. Nolan can now self-learn multiple languages, play games through thought, and then perform most tasks on his PC, things that most quadriplegic patients only dream of achieving. Of course, Neuralink will continue to enable Nolan to do even more than what we see right now. Whether you agree or not, from our point of view, Neuralink patients are getting many things that they previously only dreamed about. Not only has Nolan gained significant public attention, but he's also got numerous invitations to speak at conferences, partake in podcasts, and join company live streams. This has also opened up additional income streams for him, as he has shared that, clearly, after achieving success and stability with the first patient and to meet the goal of having 10 patients receive Neuralink chips this year, Elon urgently needed to advance testing with other patients. Thus, in July, the second patient was confirmed to have undergone implantation and has produced even more impressive results than the initial trials. Although the face has not yet been revealed, the second patient is Alex. He's an automotive technician with a passion for repairing and exploring all kinds of vehicles and complex machinery. Like Nolan Arbaugh, Alex also became a quadriplegic after a severe accident. He suffered a serious spinal cord injury that left him unable to move or perform daily tasks like he did before. Initially, the chip implantation surgery for Alex was scheduled for June, but postponed till mid-July due to the patient's unstable health condition. The monitoring process lasted nearly a month until Alex was deemed fit for the procedure. However, it was clearly unnecessary as the patient's health condition was a primary factor influencing recovery outcomes and the effectiveness of the chip post-surgery. Although both Nolan and Alex suffered spinal cord injuries, they received implants with different adjustments. This means that to avoid the issues that occurred with Nolan Arbaugh, the Neuralink team made several modifications when implanting the chip into Alex. We'll review the implantation process first, then discuss the differences in the invasive techniques used for Nolan and Alex. Initially, doctors will shave all the hair on their patients' heads to facilitate the surgery. All tools and equipment are prepared and the entire scalp area is thoroughly sterilized. Once the preparation is complete, the surgeons will make an incision about 5.8 millimeters thick on the top of the head, opening it up like lifting a car hood. Beneath the scalp is the skull, where they'll cut a round hole approximately 1 inch in diameter, then remove that portion of the skull, exposing the dura mater until the brain is visible. At this point, Neuralink's specialized surgical robot, known as the R1 robot, directly inserts the threads of the chip into the designated areas. This process is fully automated by the robot to ensure absolute precision and avoid blood vessels in the brain tissue. After successfully inserting all threads, the surgeons return to the place of the graft in the skull hole, secure it, and then stitch up the scalp. The entire process takes several hours. As we mentioned, there were changes in the implantation process for the 2 patients. The Neuralink chip implanted in Alex, the second patient, represents a big improvement over the version used by Nolan Arbaugh, the first patient. For Nolan, the N1 had 64 threads, each having 16 electrodes, totaling 1,024 electrodes implanted in the brain. Now, for Alex, the research team made some crucial adjustments. The number of threads got doubled to 128, but the number of electrodes per thread was reduced to 8. Although the number of electrodes per thread went down, the new chip still has a total of 1,024 electrodes. The increase in the number of threads allows the chip to reach more areas of the brain and provide greater stability in recording neural signals. This change is not just an upgrade in the number of threads. According to Neuralink's director of neurosurgery, increasing the number of threads to 128 effectively doubles the bandwidth and improves signal accuracy. This means that the chip implanted in Alex can record neural signals with greater detail and stability compared to Nolan's chip, opening up greater potential for controlling and interacting with the brain. Additionally, the difference in implantation depth is a notable advancement. For Nolan, the chip was implanted at a depth from 3 to 5 millimeters, but for Alex, this depth was increased to 8 millimeters. The decision was based on lessons learned from the first implantation, where the research team found that increasing the depth could minimize the risk of electrode retraction and enhance the stability of the connection with the brain. With a depth of 8 millimeters, Alex's chip not only reaches more critical areas of the brain, but also maintains a stronger connection compared to Nolan's. After receiving the Neuralink chip, all patients are required to participate in research sessions lasting 8 hours a day under the supervision of Neuralink's experts and doctors. In Alex's case, he was discharged just 1 day after the implantation. And so far, there's been no signs of the chip malfunctioning or retracting like Nolan Arbaugh's. On the contrary, Alex has been able to perform incredible tasks, controlling digital devices purely by thought shortly after receiving the Neuralink chip. Less than 3 weeks after the surgery, Neuralink recorded that 400 out of 1,024 electrodes in Alex's brain had begun to activate, showing positive signals earlier than expected. With the Link chip, Alex improved his ability to play Counter-Strike. Previously, he had to use a quad-stick controller, which had many limitations as it only allowed for alternating movement or targeting. After getting the Neuralink chip, Alex could simultaneously aim and move in the game at the same time. Alex described the experience as crazy and was thrilled to be able to move and observe in all directions just by thinking. Yeah, but there's something even crazier that makes us go wow, because not only did Alex achieve impressive video game performance, he also started learning how to use computer-aided design software to make 3D objects. You might not believe this, but on just his second day of using the chip, Alex designed and 3D printed a custom holder for his Neuralink charger, which showed Alex to quickly manipulate the CAD software, allowing him to easily switch between modes like zooming, scrolling, rotating, clicking, and dragging. That's all the latest updates on the first 2 patients in the human trial. As we said, to meet the goal of only 1 patient getting Neuralink this year and with just over 3 months left, Neuralink is forced to accelerate the final stages of the year, so the 3rd patient could get implanted next month, as the 2nd patient's condition is still showing positive signs. For the 3rd patient, Elon confirmed that the patient will still be a quadriplegic with a spinal cord injury because Neuralink's prioritizing cases that need motor rehabilitation in the first trials. The 3rd patient will also have to meet health criteria before getting telepathy. And we think patient number 3 will also get an improved chip and apply innovations in an effort to achieve the best possible results without any risks. Besides telepathy, Blindsight, which Elon Musk has confirmed will be Neuralink's 2nd product, is getting a lot of attention because its features are even more amazing in our humble opinion. A chip that allows you to restore vision even if you're born blind. This is the bionic eye that everyone for centuries has been talking about. Let's find out more right now. 2. How Neuralink Blindsight will work. Blindness is a debilitating condition affecting millions of people worldwide and can severely limit dependence and reduce the quality of life. Current tactile and auditory assistive techniques can improve independence in navigation, but have significant limitations. For example, a cane only detects objects with obstacles on the ground. And that's why Elon has set a grander ambition with Neuralink, aiming to go beyond the initial applications. Well, we mean Neuralink can restore sight to blind people, and not in a way that completely restores your eyes like a normal person. Obviously, that's not possible. In our view, Neuralink Blindsight will restore a very primitive visual perception of the outside world. Kind of like we're living in a low-res video game, like watching a video in very blurry mode, and Neuralink will be even more blurry in the early stages, as Elon writes on X. Resolution will be low at first, like early NES graphics, but ultimately may exceed normal human vision. Neuralink's blind sight restoration process involves using electrodes implanted in the brain to transmit electrical signals directly into the visual cortex. Instead of using the eye and optic nerve, a digital camera like a GoPro or smart glasses would convert photons, light, into electrical signals. Neuralink would replace the optic nerve and transmit these signals into the brain to stimulate neurons, creating a vision similar to seeing through small points of light. Photopsia. This process allows blind people to recognize objects and outlines, but initially only at low resolution, like an old-school video game. The more electrodes used, the higher the resolution. Neural interfaces have the potential to restore vision in cases where the eye cannot receive or transmit visual information by communicating directly with neural tissue. Recent advancements in wireless data, power transmission, and electrode design have led to huge advances in this area in recent years, so blind sight is a possibility, although hearing about the restoration of vision sometimes sounds a bit unbelievable. Our prediction is that patients who get blind sight will initially only see bright lights or extremely small spots, and as the device's capabilities improve over time, which may be a long time, resolution and the field of vision are also going to get better. Currently, the study will still prioritize enrolling patients between the ages of 22 and 75 with conditions like quadriplegia. According to eligibility criteria posted on the database, patients must have limited mobility that has not been improved for at least 1 year, with a life expectancy of 12 months or more. The Blindsight product may still be experimental because restoring vision is not an easy thing to do. Yeah, we think you understand that. Neuralink isn't just about medical innovation. It's also about opening up a new world of possibilities that we've only seen in sci-fi movies. It is hard to believe, but Elon is envisioning a future where humans can not only heal but also achieve superpowers. Yeah, you gotta say, that is pretty exciting. We can't help but think about telepathic communication. Imagine being able to convey your thoughts without saying a word, faster than any conversation we've ever had. Okay, initially, Neuralink focused on helping people with neurological problems recover and improve their lives. Elon has since mentioned that the company is going to focus on expanding from restoring vision of the blind to curing paralysis or treating memory loss by saving memories, which would be truly groundbreaking in history if successful. But Neuralink's ambitions don't just stop there. Elon believes that with technological advances, we can speed up communication between human and machines up to 100 times. This will not only create great strides in medicine, but also change the very way we live and interact each day. Stories like Alex's, the second person to get implanted with a Neuralink brain chip and use this technology to develop himself, doing things he usually dreams of, you know what? That is clear proof of Neuralink's limitless usefulness. In a conversation with Lex Fridman, Elon also outlined a vision where people are going to have superpowers, like talking through robots, using robot parts for quadriplegia, all thanks to Neuralink. And that really excites us. It's not just technology, but the future of experiences we never thought possible. Elon also believes that Neuralink could help humans expand their memories, upload data directly into their brains, and even develop new senses. It sounds like the Matrix, right? The ability to see infrared or ultraviolet light. Imagine having senses that currently only special animals or advanced devices have. Yeah, this superhuman vision really does have us on the edge of our seats. But of course, with every great leap forward, there's always challenges we have to overcome. Safety is a constant theme for Elon and Neuralink, and rightly so. The road's not easy. However, what we're seeing now gives us a glimmer of hope that a future where humans merge with AI is not that far away. It's closer than we think, and the change with artificial intelligence will make a dramatic difference in our lives. It's hard to believe, but it seems like we are about to enter a new era where what we once thought only existed in our imaginations is now becoming a reality. And with all the anticipation and excitement, we believe Neuralink will erase all the current controversies that the majority has about the company, and Elon will continue to bring new things to us in ways we never expected. What do you think about Neuralink's Blindsight, and what do you expect from the company's next products? Thank you so much for watching this video about Neuralink. If you found the content helpful and want to learn more information about Tesla's electric cars and Elon Musk's other technologies, make sure you hit the like button and share this video. Also, be sure you're subscribed. Big subscribe button there. Just click that bell icon and you're guaranteed to never miss our latest videos, which we update once daily, sometimes twice a day. With that, we really appreciate your support and watching and listening to this video. Hope to see you comment down there and below, and hopefully we'll see you comment down there below, and hopefully we'll see you back here in the next video. Thanks again for watching. Take care, stay safe, and God bless you. Bye.